Hello everyone, today I'm going to talk about healthcare in Mexico. My name is Laura Chang Chuen Lee and let's begin. So basically this presentation is divided in four. I'm going to talk about the geography and socio-demography in Mexico, economic context, Mexico's healthcare system, and medical tourism. Mexico, officially the United Mexican States, is located in North America. Geographically, Mexico is the 15th largest country in the world and the 6th largest in the American continent, behind Canada, the United States, Brazil, and Argentina. Some of our most important natural resources are petroleum, silver, copper, gold, lead, zinc, natural gas, and timber. Mexico has 128.6 million. The population growth is by 1.04%, and as you can see, Mexico is a young country because between 25 to 54 years, we have 41%. Life expectancy in Mexico increased rapidly over the course of the last century, but at nearly 75 years in 2017, it remains lower than most other OECD countries. While mortality rates have declined over the past 20 years, there is a big gap between men and women, and the infant mortality rate is above that of Argentina, Chile, Costa Rica, and Cuba. The main causes of death in 2015 in the general population were diabetes and ischemic heart disease, both conditions having increased significantly since 1990, followed by homicide among men, which has been stable over this time. In the economic context, Mexico's 2.5 trillion economy is the 11th largest in the world, and Mexico is an upper middle income country with one of the highest per capita incomes in Latin America. Mexico is a member of the OECD, the G20, the Pacific Alliance, and the North America Free Trade Agreement, which was replaced with the United States-Mexico-Canada Agreement in 2020. Also, Mexico has another free trade agreements with more than 40 countries. And the most important partners in terms of exports are the US by almost 80%. In terms of imports are the US by 46%, China with 17.7%, and Japan with 4.3%. Total health spending in Mexico's share of GDP was 5.7% in 2015. Public spending on health as a percentage of total health expenditure increased between 2000 and 2015 from 43% to 54%. However, out-of-pocket spending continues to be a major source of financing in the country. Mexico has a total of 230,000 physicians at a rate of 1.9 per 1,000 inhabitants. Facts. Do you know that a single day in a hospital in the US costs around 1,514, while according to the World Health Organization, the healthcare costs in Mexico are less than 120? Mexico has a mix of public health insurance programs. Employer provide health insurance and private out-of-pocket care. The Mexican health system consists of three main components. The first one is public assistance services, employment-based social insurance schemes, and a private sector composed of service providers, insurers, and pharmaceutical and medical device manufacturers and distributors. The social insurance system is dominated by three national institutions that cover all salaried employees in the formal sector. I think that the most known is the first one, as you can see, IMSS, known as IMSS, and ISTE, the second one. The second one, the Institute for Social Security and Services for State Employees, covers federal government employees. So basically the difference between these two is that IMSS is for private sector employees and the second one is for government employees. Seguro Popular. Seguro Popular is a major financial protection scheme for those outside social insurance arrangements and the employee providing them with a broad yet limited package of health benefits. Health services are provided mostly by the Ministry of Health. From 2000 up at least 2018, health policy in Mexico was characterized by the pursuit of universal health coverage as promised by the 1983 constitutional reform. And the current president, which is López Obrador, he has promised to integrate the health system and end the segmentation during his administration from 2018 to 2024. Emergency care. Emergency care is provided through emergency services facilities at both public and private hospitals. And emergency services operate 24 hours a day. The most important one, as you can see in the picture, is known as Cruz Roja Mexicana. The Mexican Red Cross or Cruz Roja Mexicana. So it's non-governmental humanitarian assistance organization. It works with some international organizations as well, and by Mexican law is the only organization outside of big cities who can provide first aid to anyone injured in an auto accident or in a commission of crime. To date, both the Mexican Red Cross and the Mexican National Health Service, IMSS, maintain hospitals in all major cities. So, how much does healthcare cost in Mexico? In general, healthcare costs vary widely depending on the doctor, hospital, or the magnitude of the situation. However, you can expect to pay a basic sum of between 350 and 500 pesos for a visit to the doctor. That's about 18 to 25 US dollars. And a visit to the optician is free. And let's speak more about costs. So if you go to see a doctor, it's about the maximum amount is going to be 45 US dollars. That is 500 pesos. But the good news also is that you can get a cheaper price. In Mexico City and I think also in other states, for people who don't have a lot of money, they can go to see a doctor and they need to pay around $2, only $2. That's pretty cheap. And for lab test services, at the of the US, CAT scan prices normally is between 25% of what you paid in the US. In patient services, patients spending the night is mostly less than 100 US dollars, and teeth cleaning at the dentist is around 28 US dollars. And also something pretty good about the healthcare is that normally a visit per doctor takes 20 minutes. They usually listen to you, they examine you, they make sure that you don't have anything wrong, because sometimes probably you just say what you feel, but the doctor at the end is going to say that you have something more, something that you didn't know, and they really care about you. So the healthcare service is excellent. Signing up for the healthcare system. Signing up of healthcare in Mexico is pretty easy for those who qualify for IMSS. Here are two steps you need to follow. One, you have to be fully and formally employed in the country. Here, your employer makes the necessary deductions to your salary to ensure that the AIM services are fully covered. The second step is through voluntary enrollment. It's usually open to those who are enrolled in formal employment as well as those who just choose optional services. Some good examples include retired foreign residents living in Mexico. Mexico does not have an integrated pharmaceutical policy, but sectoral health programs include strategies and action plans to improve access to medicines. The Mexican pharmaceutical industry ranks second in Latin America behind Brazil and includes a total of 742 pharmaceutical companies in operation. The public sector procures medicines through approved lists and consolidated purchasing. Millions of U.S. citizens take advantage of Mexico's medical tourism industry every year, with patients very often paying out of pocket and still making a saving over using facilities back at home. Mexico is ranked at 61 in the World Health Organization's league table of countries for performance of its healthcare system. Around 1.2 million travelers from different parts of the world go to Mexico to undergo medical procedures. For Mexico, the medical tourism industry represents revenues of 23 billion US dollars. And Mexico has a position which is considered to be as one of the most important countries for medical tourism because it has a record of 1.8 million travelers. 8 out of 10 travelers who visit Mexico with medical reasons come from the US. Basically, they're coming most from California, Texas, New Mexico. Medical tourism is defined as travel beyond a home country in search of health care that is either less expensive or more accessible. Medical tourism is an increasingly popular trend that has expanded over the border region of Mexico and the U.S. The economic situation in the U.S. has left a large number of Americans without health insurance and unable to pay for expensive surgeries, prescriptions, or even routine dental care. Therefore, they're opting to travel across the border to access less expensive care in Mexico. Seeking medical treatment from other countries, a phenomenon already popular in other areas of the world, is becoming as a viable option for American citizens, especially the uninsured. Of the patients in board and dental clinics, 80–90% are Americans. And Mexican hospitals operate differently in terms of their customer base. There is not a single hospital currently treating more American patients than Mexicans. The most popular procedures are related to obesity, orthopedic knee, hip replacements, cardiac and coronary procedures such as valve replacement, plastic surgery, and dental work. Medical and dental cost comparison between the US and Mexico. There are three reasons of the high cost of healthcare in the United States. First is physician-induced demand, third-party payments, and defensive medicine. Physician-induced demand wastes resources on unnecessary health care procedures. Studies conducted by Rand Corporation reveal that one-third or more of all procedures performed in the United States are either not beneficial or questionable. The lower of medical care in Mexico, however, comes from several factors, including the low salary of doctors, nurses, and other staff, a lower cost of living than the US, and the lower malpractice insurance rates, lower construction fees, and cheaper overhead costs. Which are the challenges that the Mexican healthcare system is facing? The system faces challenges with obesity, diabetes, violence, as well with health inequity. Both civil society and government are calling for greater integration of service delivery across public institutions, although no consensus yet exists as how to bring this about. Income inequality and poverty are persistent health challenges. Of the 36 countries making up the OECD, Mexico has the highest level of income inequality. Public care is fully or partially subsidized by the federal government, depending upon the person's employment status. All Mexican citizens are eligible for subsidized health care regardless of their work status. The overall structure of the Mexican health system is in continually development. And in reality, the country's private and public health programs are highly accessible for citizens and residents alike. The quality of healthcare is high, and likelihood of finding a doctor who can treat you in your native language is greatly increased thanks to the significant number of Mexican doctors who go to medical schools in the US and Europe. And to finish this presentation, I wonder how is the healthcare in your country? Thank you so much for your time.